Yes, welcome. This is Mpandi Shepherd Stephen, a Commonwealth people living with disability advocate and also a mental health champion in mental health Uganda. So today I will talk about mental health because we are in the mental health month. Yes, every time it comes to October of every year is a mental health month. Just quote it. So I had to stream a video at least to address issues concerning mental health. So every time you get a mental illness, you are affecting your mental health. Yes, mental illness is part of mental health. So in this video, I'll talk about the causes of mental illness. I'll talk about how to live with people living with mental illness and how to live with it. And I also address how to get medication and counseling services for these mental illnesses. So let me go straight forward. You should know that everybody can get affected mentally. Yes, there are many mental illnesses in the whole world. I can't exhaust all of them in this video, but you can go on searching websites and then you look for mental health illnesses. So I should tell you that mental illness is caused by an accident. That is one of the causes of mental health. 2, it can be caused by another disease, that's to say, for example, cerebral malaria. Then it can be caused due to distress. Maybe you think somebody bewitches you. You think this work I'm doing, it's so tiresome. They don't pay me very well. I feel like moving on. Yes, you can get mentally disturbed. So how to handle these situations? These situations are handled in various ways according to the kind of mental health or mental disease or mental illness you have. Yes, you can know how to handle a situation. For example, somebody living with epilepsy. Whenever you feel maybe very happy, that's when it happens. Maybe when angry, yes, you can find every area when you know that is happening in the next minutes, maybe 5. Then after looking for that area, you lay down. It should be at least a good environment free from obstacles such as stones, so that you can't hit your head or yourself and harm yourself the more. So yeah, and the rest, there are those living with 2 other diseases. That's to say you have a mental illness at the same time you are having also, for example, asthma. So you should find areas that are warm whenever it gets cold. 2, you should know maybe when I've gotten hungry, so it is cold, let me find somewhere warm. You find maybe you have asthma and epilepsy, at least you can find a free area still at warm. Then you lay down and do yourself what they call a physical, psychosocial first aid. Yes, you should know how to handle the allergies, the causes of your mental illness. I don't know the rest, but you should go to your medical personnel or medical facilities and get to know what is the cause of your mental illness. And after that, they will give you also more details on how to handle it. Yes. So living upon the causes of the mental illnesses and the mental illnesses. So let me go straight on how to get medication and counseling services. So whenever you have a mental illness or somebody with a mental illness, you should get medication. That's one. Two, don't self-medicate. Move to an area where you know that it is authorized to offer psychiatric services. Mostly you go to your main hospitals in your area. That's where you can get at least a good physical psychosocial and physical psychosocial education. You get both the aid and the education. So altogether, you should be at least visiting your health facility at least twice in a week. Also, when I'm talking about how to handle such situations, always eat a balanced diet. When we talk about balanced diet, I'm not talking about only food, but I'm talking about also the drinks. Yes, always eat natural food, but always take natural drinks. Desist from alcoholic and energy boosting drinks. This will help you also on how to handle mental illness. Yes. Unless you have any other questions, you can inbox me in the comment sections below. I'll be able to address them. I remain Mpandi Shepherd Stephen, a mental health champion in mental health Uganda, and a Commonwealth people living with disability advocate fan. So, concluding by saying, do you read this? It says, end the stigma. Mental health matters. So, you should end the stigma. Wherever you are moving, wherever you are going, don't get stigmatized. Even if somebody abuses you about your mental illness, even if you get your mental illness or you get something affecting you mentally, you should just know how to handle it rather than quarreling, rather than exchanging words or revenge. Bye-bye.